Great. So first of all, let me add my thanks to colleagues from EANJ and BIA, and also thanks to um, uh, Robert Wood Johnson Foundation and our colleagues at Wakely, RWJF, Kathy Hempstead in particular, and also the folks at Wakely were more than just sort of the bankers on this project. We've just got a lot of tremendous input from them. But as I always say, any errors and omissions are those who belong to those of us who ran the data. So don't blame them, blame me. So let's go to the next slide, please. So first I have just a few background slides, and this one is sort of, to this folks on this call, like extraordinarily basic, but let's start at the beginning. This is how we do health insurance in the United States. We're about 2/3 private insurance, and that's mostly driven by the employers. The next slide is the same thing, but for New Jersey, where we're even more heavily dependent and reliant on the private health insurance market. That's largely because we're a higher income state. We have employers that offer health insurance disproportionately so compared to the rest of the country. So this is a really important topic. Obviously, we're trying to minimize that little gray slice, the uninsured, and make the markets work in the private sector. And that's really what we're about today. A little bit more background on the next slide, please. I show this with a little trepidation because this webinar is not about, we're not going to talk about what's up with the regulated small employer health insurance market. That's a big topic for a lot of reasons, and something that I know many of you live every day. But it's really important background for these HRA options as we think about creating options for small businesses, and not just small businesses, but small businesses especially, to help their workers gain access to affordable coverage and ultimately affordable healthcare. We are at the moment where we have roughly the same number of people in the individual or non-group market as we do in the state-regulated small employer market. I think the next slide, at first glance, is going to seem a little inconsistent with this, but I think raises some good questions. So this comes from a national survey conducted by the Agency for Healthcare Research and Quality. It's a survey of employment establishments, and it asks, do you offer health insurance to your workers? And this is the number of small employers that offer it over this time span. And as you can see, New Jersey is quite stable and quite favorable relative to neighboring states and the US as a whole. And what this suggests to me is that employers are still in this game very much. They do want to be offering, that they're finding ways to do it, but maybe a little bit less through our state employer health benefit program than they did in the past. So with that as background, let's go on to the next slide. So our topic for today is to talk about these two comparatively new health reimbursement arrangements. It's with some humility that I give you background on this, because I know there's probably of the 50 or so folks on this call, 49 who know more about this than I do. But let me, bear with me, I'll go through what I know, and then when we get to our panel, they'll either correct me or fill in the blanks. So first of all, these are fairly new arrangements, as you can see on the slide. They have been received by stakeholders, lobbying groups, and representatives for employers, employees, and others with some mixed enthusiasm, shall we say, and some skepticism. And we, if we want in the Q&A part, we can talk about what those feelings are. But I think it's just important background to know that these didn't land with a universal embrace or a universal rejection. A common theme here is that these mechanisms can be used to offset workers' costs in ACA compliant individual market plans. So they can do more than that, but that's an important theme here to keep in mind. And as we saw those two lines in the individual and small group market, I think there is more fluidity between those markets now, and some changes from the ACA and other things that led to that. So the QCERAs, the qualified small employer HRAs, were enacted as part of the 21st Century Cures Act in 2016. They apply only to small firms. If they're offered, they must be offered to all full-time employees. Employers can contribute up to a capped amount, so there's a maximum contribution. If they do offer it, the employer may not offer a group plan. So it's really an alternative to a standard group plan. Importantly, I think employees may combine dollars out of the QCERA account with ACA premium tax credits to buy in the individual market if they're eligible for tax credits. ICRAs are different. So they were created under federal rulemaking authority in 2019 in the Trump administration. They reversed a prior ACA rule that prohibited employers from using HRAs to pay individual market premiums. Generally, they're more flexible than the QCERAs. They apply to employers of any size. They can be offered alongside a group coverage option within a given employer. They may be offered to specific classes of employees. They don't necessarily have to be offered to all employees. And the list of classes of employees are specific and kind of long. So they can play a niche role. There's no cap on employer contributions. So they're very different from QCERAs along those features. However, employees using ICRA dollars to pay for marketplace coverage cannot also use premium tax credits. So it's a one or the other thing. So that's different too, and that's a little less flexible than the QCERA. So that's the quick background on these arrangements. So let me now turn to what we've learned through our survey. Sorry, I had a couple more slides. Before we do that, so there are lots of these are new arrangements. There's lots of questions. So this is really the questions that we had in mind when designing the survey and thinking about this panel is, what's the potential impact of these on the small group and individual markets? Are they fragmenting the markets? Are they augmenting the markets? What incentives do brokers and health insurers have to deal with these products? And we can't really get at that in the survey, but we can in the panel. What awareness and uptake or take-up is there among employers? And that's what the survey was really about. For those who have taken it, what's their experience been? We tried to get at that. And then what are the issues? What are the regulatory issues and the policy issues here? And that's sort of the bottom line, at least to the extent we can reach a bottom line today that we want to talk about. Next, please. So this project is one of an array of things the Robert Wood Johnson Foundation is doing around these options. They're doing a national outreach and awareness campaign with a group called Public-Private Strategies. They just kicked that off in October. They have done some additional research, and I think this might be a link. So if you can send the slides, you'll be able to get to it. And then, of course, the last thing is our project. So now I think I'm ready to go on. Thank you. All right. So here's what we did and what we found. And then we'll save as much time as we can for the panel. So next, please. So here's the project team. You met Margaret and me. Jolene Chow is our analyst working on this project and did all the hard work putting this together. And Michael and Michelle from Wakely were just tremendous supporters, not just in the contracting, as I mentioned, but also in helping us think about the right questionnaire and so on. Next, please. So we've been through most of this. I mentioned Kathy's important role, Alan Monheit, who I think is in the bleachers in the audience, advised us on this as well, professor of health economics at our School of Public Health. And then, as you can see on the slide, some of the team at the Agency for Healthcare Research and Quality were really helpful as well. And they do the MEPS survey that I showed you earlier with the offer rates. And we borrowed their questions shamelessly with permission because they're really well tested and well fielded questions. So we mirrored their methodology to the extent we could, and they were great advisors on this as well. And then we also have been introduced to Kyle, John, and Robert. Chrissy was, I guess, has moved on from BIA, but was really instrumental in working with us at the front end of the project. Next, please. So what did we do? So we designed this to explore employer familiarity with and adoption of these two specific HRA options. It was an online survey distributed by our partners at BIA and EANJ to their pre-existing lists. So it's not a random sample, but it's a very broad sample, as we'll show you. It was conducted April through in May, earlier this year, and we ultimately had 184 responses from firms with at least one location in New Jersey. And you can see across the bottom row here on this slide that it was the people actually answering the survey were in a position to answer the survey. So about a third from the HR departments, 20% were owners, 12% CEOs or other senior executives, and then the remainder in other kinds of roles. It doesn't mean they knew everything about their firm's HRA options, but they were in a position to know a lot. So let's go on. So we had responses from every county in New Jersey that distribute across the state, with a little bit more representation from the central Northwest and the Northeast regions, Central East. So it's a pretty good distribution. It's not, it doesn't map exactly to the population distribution, but it's essentially where the people live. So that's a good reflection of the sample. Next, please. So in order for us to sort of gauge the nature of our sample and the folks who are responding, this shows you the distribution by a number of employees. The gray, the diamonds with the gray numbers represent what's in the medical expenditure panel survey, that national survey that AHRQ does. So it looks like we are slightly underrepresenting, or we are underrepresenting the smallest firms and slightly overrepresenting larger firms, which doesn't surprise me because it's a health benefits survey. And if you're not offering health benefits in the tiny firms, you're not going to respond. So, but it's still a pretty good distribution. Next, please. So we had pretty good representation across these broad industry categories. Again, the gray is from the national data for New Jersey. We do seem to be underrepresenting retail and other services a bit, or actually quite a bit. And not everyone in our survey gave us enough information to classify them. But in terms of professional services, we do well. Goods producing sector, we actually do better in terms of representation. Next, please. So here's the bottom line, the slide everybody has been waiting for. So This is puts together answers to questions: do you offer one or the other? And if not, how likely are you to offer? And the blue part of the bar shows that a tiny number actually offer, and it roughly equivalent and still tiny numbers say they are likely to offer. So the light blue is likely, the lower darker blue is actually offering. So we can count these on two hands. The next bar over, the salmon color, are those who say somewhat unlikely in the light color and not likely at all in the darker salmon color. So a third or so say they're not likely. By far, the most common response was, I don't know, or they simply didn't answer it. So, and you'll see why I think that's the case in a moment. So let's go to the next slide. So of those who don't currently offer, these were the reasons they gave us, and they could give more than one here. By far, I mean, half the respondents who didn't offer answered, we don't know enough to decide whether to offer. So we have a educational a challenge here. The next most common responses, their broker or agent didn't recommend it. It was too complicated to administer. Employees aren't interested, or the respondent didn't feel that it was the right thing for their employees. It's a smaller number. Next, please. So those are we have a lot more data, but that's the essence of our findings. So just to wrap up this part of the talk, so we see rising premiums and declining enrollment for traditional employer-sponsored plans. Our survey found very few employers currently offer or plan to offer these flavors of HRAs. Lack of familiarity was by far the most common reason stated for not offering them, and leading to the bottom line that if people don't know about it, the first step seems to be to educate employers about their options.